Inspire hope, promote wellness. This is Compass Points. Hi, this is Dr. Paul Tomlinson from Compass Health Network. On this show, I'll share ideas, hacks, tips, and skills drawn from research in the behavioral and health sciences. You can think of Compass Points as navigation assistance for the path to better health and wellness. So let's get to the Compass Point. Every few years, Compass Health Network pauses to ask a really important question, one that sounds simple but definitely isn't. What do our communities need most right now? And what are they going to need next? That question sits at the heart of our Community Health Needs Assessment, or CHNA. And while, yes, it's something nonprofits are required to do, it's a lot more than a box to check. At its best, a needs assessment is how we make sure we're not just busy, but actually heading in the right direction. I like to think of a needs assessment as a map. Now, to be clear, it's not one of those GPS maps that tells you exactly where to turn, left or right. It's more like a terrain map. It shows you where you are, where the ground gets rough, where the steep climbs are, and where there might be real opportunities to make progress. And just as importantly, it reminds you that you don't navigate alone. We build this map together with community members, with partners, with staff, with the people we serve every day. The Health Needs Assessment is, at its core, an exercise in listening, careful, intentional listening. So what did we hear in our 2025 Needs Assessment, which took us almost a year to complete, all told? Several themes came through loud and clear. First, and probably no surprise to anyone listening, behavioral health needs are growing. Across every region we serve, more people are seeking help for depression, anxiety, trauma, and substance use. Demand continues to rise and complexity is increasing right along with it. Where this feels especially urgent is among children and adolescents. Youth are navigating a mental health crisis layered on top of academic pressure, social stress, economic uncertainty, in a world that feels, let's just say, a little bit heavy right now. The takeaway isn't that young people are fragile. It's that they're responding to real stressors and they need systems that can respond to them. The second theme, I'm going to point out here from our needs assessment, is one public health has known for a long time, but still bears repeating. Where you live matters. Rural regions and higher poverty counties experience higher rates of premature death, chronic illness, and behavioral health challenges. These patterns aren't about personal shortcomings or bad choices or anything like that. They often reflect differences in access, that is, to healthcare, transportation, employment, education, and basic infrastructure. In other words, health outcomes often follow opportunity. When opportunity is uneven, health will be too. And we certainly saw that to be the case. The third thing we heard over and over again is that barriers to care are often structural. People want help, but getting care isn't always easy. Transportation can be a challenge. Provider shortages remain very real. Insurance coverage doesn't always line up with needs. Stigma still exists. And in some areas, crisis options are limited or hard to access in the moment that they're needed most. So sometimes the problem isn't motivation, it's navigation. The system itself can be confusing, fragmented, or simply stretched too thin. That matters because even the best services don't help if people can't reach them. And finally, the needs assessment reinforced something that public health folks, again, have been saying for decades, and something we're all finally getting better at hearing. Social determinants of health are not side issues. Housing stability, food security, education, employment, and safety are not nice extras. They're central drivers of health and wellness and illness. You can't meaningfully improve behavioral health in isolation from these broader conditions. Mental health doesn't live in a vacuum. It lives in homes, neighborhoods, schools, and workplaces. So when we talk about needs, we're not just talking about services that Compass provides per se, for example. We're talking about systems, we're talking about environments, and we're talking about the conditions that allow people and communities to thrive. Which brings us back to the original question. Why do we do a needs assessment at all? Well, because you can't navigate without a compass and a map. Because hope requires strategy. Because serving well starts with listening deeply. even when what we hear is complicated or uncomfortable. A good needs assessment doesn't just list problems, it highlights patterns, it clarifies priorities, and importantly, it illuminates possibilities. It helps us decide where to invest, where to innovate, and where partnerships can make the biggest difference. The big takeaway from this year's assessment is this: our communities are facing serious challenges, but they're also full of resilience, compassion, potential. There's no shortage of strength there. When we listen carefully and plan thoughtfully, as we are trying to do at Compass Health Network, a needs assessment becomes more than just a report. It becomes a roadmap. Over the next months, we'll be sharing more, diving deeper into specific needs, the data behind them, and how they're shaping our priorities moving forward. So this Compass Points podcast series will be one of the ways that we will keep that conversation going. So thanks for listening, and thanks for being part of the journey as we figure out together where to go next.